Hello everyone, welcome back to Dr. Gauda's medical coding classes. So today I'm discussing about chapter 12, diseases of the skin and subcutaneous tissue. And this chapter is having code range of L series, that is L00 to L99. So this chapter have guidelines mainly for two conditions. First one is pressure ulcer stage and second one is non-pressure ulcer. Okay, pressure ulcer as well as non-pressure ulcer. So what is pressure ulcer? Pressure ulcer can be also called as bed sore or decubitus ulcer. It is nothing but that ulcer or wound which is created when a patient is bedridden for a long time. Okay, due to the pressure between the skin with and the bed. Okay, the wound that is occurring is called pressure ulcer. Okay, it is also known as bed sore. Okay, so the code for pressure ulcer is L89. So when you're taking code for pressure ulcer, you have to look for two things. First one is the site or location on which the pressure ulcer is present, and the second one is the stage of pressure ulcer. For example, when you take L89 code in your ICD-10 book, you can see L89.0, L89.1 like pressure ulcer of elbow, pressure ulcer of uh, different site you can see. Okay. Then the next one is stage 1, stage 2, stage 3 like that. Okay. So you need to look for the site as well as the stage of pressure ulcer. Okay, and accordingly you have to code stage 1, stage 2, stage 3 or stage 4, and there are some more cases. Sometimes it may be given as deep tissue pressure injury. Okay, deep tissue pressure injury. In that case you have to take code for that. Okay, and there are two more cases, unspecified stage and unstageable. So what is the difference between unspecified stage and an unstageable? Unspecified stage means the stage of pressure ulcer is not specified by the doctor. Okay. And what is unstageable? Unstageable means the doctor specifies that the stage cannot be determined. That is unstageable. Okay. So first you have to look for the site of pressure ulcer. Then you have to look if it is stage 1, 2, 3, 4 or if it is deep tissue pressure injury or if it is unspecified or unstageable. Okay, accordingly you have to take code from L89 series. Now unstageable pressure ulcer. So what is unstageable pressure ulcer? I have already mentioned that when the doctor or the physician states that the stage of the ulcer cannot be clinically determined. Okay, in this case there should be a documentation which specifies that the stage cannot be clinically determined. Then only you can give the code for unstageable pressure ulcer, that is the last character will be 0. Okay, and last point, ulcer covered by a scar or has treated with a skin or muscle graft. If such a statement is present there, that is ulcer is covered by a scar or it has been treated with a skin graft or muscle graft means also you can give the last character as 0, that of unstageable. Okay, next one is unspecified stage. So what is unspecified stage? When the stage of pressure ulcer is not specified by the doctor. Then the last character will be 9. Okay. Then documented as healed. That is, at the time of admission, if the pressure ulcer is documented as healed pressure ulcer means no code is present for that. Okay. You need not code for healed pressure ulcer at the time of admission. Okay. The next one is documented as healing. That is, if the diagnosis is healing stage 1 pressure ulcer means what you have to code? You have to code for this same stage 1 pressure ulcer, whatever be the site according to that. Okay, and the last one is present on admission healed at the time of discharge. That is, some stage of ulcer is present at the time of admission, but that particular stage is healed at the time of discharge. Means whatever be the stage at the time of admission, for that you have to code. Okay, for example, the patient is having stage 1 pressure ulcer at the time of admission and healed at the time of discharge, means you have to code for stage 1 pressure ulcer. Whatever be the code for stage of admission, you have to code that stage. Next one is pressure ulcer evolved into another stage during the admission. Usually, we have seen in another chapters, for all cases, when one stage evolves to another means we usually code for the severe one, no. But for ulcer case, there is a difference. That is, when the pressure ulcer evolves from one stage to the higher stage. For example, stage 1 pressure ulcer evolves to stage 2 pressure ulcer after admission, means you have to code for both stage 1 and stage 2. Okay, you have to code for both stages. Okay, then last one, pressure induced deep tissue damage. If the condition is pressure induced deep tissue damage, means the last character will be usually 6. Okay, then next one is non-pressure chronic ulcer. So the guidelines for this pressure ulcer and non-pressure chronic ulcer is same only. Okay, so the first point, documented as healed at the time of admission, no code. Same as what we seen in the pressure ulcer. If at the time of admission, if it is healed pressure ulcer, means you need not code for that one. Okay, documented as healing. If it is mentioned as healing pressure ulcer, means you have to code whatever be the stage, that stage you have to code. Okay, then last one, non-pressure ulcer evolved into another severity during admission. From one severity to another severity means you have to code for both. So that's all for this chapter. This is a very simple chapter. If you understand, the guideline for pressure ulcer means the same is applicable to non-pressure ulcer also. So thank you.